Okay, this is Dr. Benno Rucker here. This is my latest toy. I can show you what I'm looking at on the screen and we can have some fun deciphering information. I guess I'm on a kick this morning because I keep meeting lots of patients who have recommendations by surgeons for various procedures. I'm going to take on a very interesting one, and that's heart surgery. One of my favorite speakers, a medical doctor named Dr. B.M. Hegde. And actually, I'm going to take you to one of his YouTube clips. I think everyone should watch this. So I'm going to pull this up. And I'm going to pause things while I pull it up. Okay, here's Dr. Hegde. I'm using my arrow, right? Belly Monapa Hegde. He's 79. Extremely bright. Over here, here's one of his TED Talks that I recommend many people to watch. Let's pull up this article. In a candid chat, renowned cardiologist busts several something. Matters of the heart. So in a candid chat, the renowned cardiologist Dr. B.M. Hegde busts several myths about cardiac ailments. Squeezing a wedge of lemon into a glass of warm water is the best medicine for an acidic stomach. You don't have to run to the hospital for every ailment. Some of these things are going to sound very simple, but this guy is one of the smartest physicians I've ever read. The leading cardiologist also notes that in reality, there's not been even 1% absolute increase in the rate of heart attacks. It is plain hype. He calls it labeling error. Unfortunately, every chest pain is dubbed as angina, and every block is labeled coronary disease. Anybody walks in a hospital complains of chest pain is made to undergo an angiogram. Blocks happen when you are young, and as they grow, nature provides bypasses through collateral vessels. This is called preconditioning the heart. He believes any individual who sees a doctor for medical help immediately becomes a patient. Once you get caught in the whirlwind, you continue to remain a patient. When I was a student, I questioned how can cholesterol be bad if it's made by our body. 40 years ago, I wrote that cholesterol is a counter by the body to increasing stress levels. I said coconut oil is the best oil for the heart at the American College of Cardiology long ago. And I didn't intend to read this whole article, but I can't help it. He's just so intelligent. The flaw of today's approach to treatment is that the human body is seen as a car machine which can be repaired part by part, whereas a human body is a whole entity and should be treated as an entity. How else can one explain the side effects of drugs used to treat one organ? Yeah, I suggest for anyone who enjoys anything I have to say to read more of Hegde's information. So now I'm going to move to this other article. I'm going to hit pause. So let's dig into this one, because this ties into what Hegde has to say. Let's see. Oh no, they took it away from me. Hold on. There we go. Good. It came back. All right. Elizabeth Klodas, cardiologist, president of Preventive Cardiology Consultants. All right. She's also the founder of Step 1 Foods, Strategic Dietary Change. All right. Let's see if she has any intelligence. There's her background. Monday, January 16, 2006. Bypass surgery. Is it a medical fraud? I'm going to argue yes. So, over on the Heart Disease Support Board, Vlad reports that his dad recently suffered a heart attack, and there's now a controversy in his household on whether or not his father should undergo recommended coronary artery bypass and mitral valve replacement surgery. Vlad shares that his dad is frightened at this prospect, and his mom read a book called Heart Frauds. Looks like I got to get that book. By OBGYN Dr. Charles McGee. So according to Vlad's post, the premise of McGee's book is there's never been any actual proof that CABG surgeries extend a person's life. You know, I've always intuitively believed that, and Dr. Hegde has confirmed that. Vlad writes that he is terrified of pressuring my dad into potentially life-threatening surgery if he could survive without it. I will say this. I remember when I was younger, looking at the heart surgeons, they had the most wives, the most cars, and the most girlfriends. Now, the cardiologists started having the most wives, most cars, and the most girlfriends when I was young and watching a lot of those guys in the community. So Vlad should be terrified about the financing these guys and their lifestyles, and the fact that they're probably doing techniques that really don't work. So Vlad asked an interesting question. First of all, this lady, I love this. First of all, in this day of evidence-based medicine, I really doubt the surgeons would continue to perform a procedure that has no merit whatsoever. Okay, Elizabeth, let me allow you to wake up. You are out of your mind. Do not trust the foxes guarding the hen house. All right. Second of all, cardiovascular disease has been proven to be progressive. If a person chooses not to have surgery, they will eventually have the opportunity to make that choice again. American Heart Association analysis of 7 studies of individuals who chose medical management rather than open heart surgery. Almost half crossed over to bypass in the 10-year follow-up period. That doesn't help me a lot. So let me pause now. Well, I'm going to conclude my message looking at some of the information she writes. Addressing the question of long-term survival, the AHA reports here 7 trial meta-analysis that looked at the comparison of surgical versus medical outcomes at 5 and 10 years. Among all these patients, the extension survival of bypass surgery compared to medically treated groups of patients, which, mind you, they don't even know how to treat people properly in the first place, was 4.3 months at 10 years of follow-up. You know, that almost, I'm not going to get into the complexities of what's down here, but that almost shows you medical management, which is already crappy at best because they use, you know what, I'm going to point out here they use in medical management. Here it is. Beta blockers, ACE inhibitors, and lipid lowering agents. So an unproven fraud is equal to another unproven fraud. And all you're going to get after 10 years is 4.3 months, which is probably just statistical sampling error. So I guess what really should be said is none of these people know what they're talking about. Patients need to self-educate. And a book I've been recommending to my patients to read is, I think it's called Understanding Heart Disease by Lynn McTaggart. I'm going to pull that book up. Okay, here's the book. What Doctors Don't Tell You About Heart Disease, Lynn McTaggart. I guess it's good to end with an article by Lynn. Oh, no thanks. Let's see. Okay, good. Conventional medicine is largely built upon the idea that any damage on the body, especially the heart and its arteries, can't be undone when we're adults, and that symptoms can only be managed by drugs, such as statins and antihypertensive agents, until surgery becomes necessary. See, I'm not crazy, folks. This dismal view boosts drug company revenues, as the vast majority of their income comes from drugs that manage chronic and intractable health problems, such as cardiovascular disease. We might have been the architect of our own fate through poor diet, lack of exercise, and smoking, but can't also we be the dismantler of the edifice of ill health that we've created for ourselves? So I'm going to leave you guys with that in this amazing book, What Doctors Don't Tell You About Heart Disease. I've also read a lot of Lynn's work, The Intention Experiment. So have a great day. I hope anything I'm saying helps somebody out there. Dr. George Benno Rucker signing off, and our office number is 941-448-1199.